We're writing an exam. Okay. We are writing an exam that is basically a clinical exam. As writing Plab means you're going to practice clinical medicine. And this does not look like clinical medicine. But the reason why this is part of clinical medicine is in every textbook we read, for every single symptom, for every single investigation, risk factor that we find in our books, it has to go through these processes. For example, for a statement like diabetes is a risk factor for hypertension, it has to go through a lot of research. So once upon a time, we had diabetics. We knew what diabetics were. We knew what hypertensives were, but we didn't know there was an association until research like this happened, and then the association was created before it got into our textbooks. So even before things get into textbooks, as a clinician, you should be able to review literature and academic data that is available and make informed clinical decision. And that is why the entire epidemiology and biostatistics are important for a clinician. Now, moving on, what this question is trying to say is a group of people were studied for a certain research, and some of these people had certain factors they did not mention specifically. Maybe some of them were smokers, some of them were alcoholics, some of them were obese people, some of them were vegetarians, and so on. And then at the beginning, they only had these certain factors, but over the years, the other factors developed that were not there initially. What do you call this kind of a design? So the key word that will help us answer this question is cohort. So when we say the word cohort, we are talking about someone who was studied over time. Whether he was studied into the future or into the past, it is still a cohort study. So the point of a cohort study is everybody is going to be studied. Those with the factors, those without the factors, and then we look and see what the difference in the outcome is. When we take that and compare it to case control study, a case control study, you don't study over time. You just study people who are cases. That is, for example, diabetic people. You just look for 100 diabetic people and you study their lives. Then you look for controls, people who are not diabetic. So that is why it's called a case control study. Those 100 people who are not diabetic, they will be your controls. Then you study them. Then you start to make associations. You say, okay, these diabetics, most of them have a family history of diabetes. But most of the people who are not diabetic also have a family history of diabetes. So maybe family history is not that relevant. Then you move to the next thing you found in your case control study. Most of these diabetics, they consume a lot of carbohydrate and starchy food. The non-diabetics do not do that. So in that way, you can create a relationship. You can do a case control study in 1 week if you evaluate all your data as effectively as you need to. But for a cohort study, you need to study them for a long period of time. Doctors, is the difference between these two main categories of studies clear?
Yes, sir.
Okay. Then we talk about a randomized control study. This is done with the help of, for a randomized control study, you have to be introducing things and observing the differences. And prevalence is when you try to estimate or try to calculate the total number of people that have a certain condition within a time period. So the most important, the thing is, these things we have many more different kinds of studies, and this is actually, I don't think there's been a Plab exam in the past 5 to 10 years without questions like this. And for that reason, when we start the proper classes, we are going to dedicate significant amounts of time to look into all of these and make sure everybody understands them properly. Now, having established that because of a period of time, our answer is going to be cohort study, Dr. Itumu Olua. Are you looking at a prospective cohort study or a retrospective cohort study? What do you think the answer should be?
Between retrospect and prospective.
Yes.
Um, I don't know,
So
but
it says they are followed over time. It means they are followed into the future.
okay.
So is the future in retrospect or the future is a prospect?
Okay. Retrospect.
Exactly. No, retrospect
Retrospect.
means moving backwards.
Okay.
And since these ones were followed ahead into the future, this is going to be a prospective cohort study.
What
Is
study?
that clear?
Okay. Yes, sir.
Yeah, so it's just understanding what the the question is asking, and sometimes you may even need a bit of linguistic familiarity to be able to pick the answers, but these are very straightforward and easy things that once you get to grasp of the concept, it shouldn't be too difficult. So is our first question clear, doctors? Doctors, is our first question clear?
Yes, Chief.
Okay. So let's proceed to the second question. Okay. Dr. Isti JN, I can see all your replies. Well done, Dr. Paul as well. I assume you both are in a place you can't talk at the moment. Okay. Thank you very much, Dr. Itunolua. So can somebody else volunteer to read the second question? And save us the time to take to find someone. I'll call their name out. Okay. Dr. Treep City. Very interesting name. Dr. Treep City or Dr. Chioma, is any of you available and free to read the question?
I can read the question. Okay. Okay. 10,000 women underwent a newly developed cervical smear screen. 1,000 of them had a smear result which shows premalignant changes and had further investigations and biopsies. Only 100 women who had undergone biopsies had premalignancy changes seen on histology. What is the single best term to describe the cervical smear test?
So we understand the picture the question is trying to paint, right? You understand what picture the question is trying to paint? So the question is saying 100,000, 10,000 women had a test. 1,000 of them were positive. Is that not so? Dr. Chioma, at least up to the stage, everything is clear.
Yes.
Okay. Now, 1,000 of them were positive. But this test is a new test. We don't really know how effective it is. Maybe the test was just somebody looking at the faces of the women and be like, positive, positive. So we don't know how effective it is. How do we confirm? We compare it to an already established test, which is the biopsy. When we did the actual biopsy, out of all the 1,000 women that were positive, only 100 were actually positive.
Okay.
Do we understand this concept?
Yes.
So it means we have a lot of people, that is 90% of them who tested positive were not actually positive. So what do we call this in epidemiologic terms? Does anybody have any idea? When we have a lot of people who test positive, but they don't have the disease. Somebody, anybody, before I...
False positive.
Very good, Dr. Corbena. So that is a false positive. Somebody does not have malaria, but he did one test somewhere in my backyard because I want to collect his money. And I tell him he has malaria, so that is a false positive result. So we can, by that information alone, we see that it's not a true positive rate. So this is wrong. It's not a true negative rate. This is wrong. It's not a false negative. It has to be between specificity and sensitivity. An easy way to remember it is positives, false negatives. Dr. Chairman, are you there?
Yes, sir. Yes, sir. The network was
Okay.
breaking.
So what do you think the correct answer to the second question should be? Huh?
Hello, sir. What did you say, please?
I said, what do you think the answer to this question should be?
Yeah, false positive. The low specificity. Yeah.
Exactly. So the correct answer to the second question should be option D, low specificity.
Sorry, could I ask a question?
Yes, please.
Can you say the difference between high true negative rate and high false negative rate?
Okay. So you understand, before we answer, you understand the difference between a true negative rate and a false negative rate, right? Or what true negatives are and false negatives are.
Yeah, a little bit. Yeah.
Okay. So we know a true negative is when somebody who does not have the disease undergoes a test and then the test says they do not have the disease. So if you want to remember this correctly, look at the term negative. So the negative tells you what the result showed. So if it's whether it's false negative or true negative, you know when the person tested, they tested negative. So the importance of this true negative will now tell you, was that negative result true? Or if it's a false negative, it means that negative result was false, meaning the patient was actually not negative, even though they tested negative. Is that clear so far, Dr. A?
Yes, it is. Thank you.
So when we say a test has a high true negative rate, we are talking about a test that is good. Meaning for most people who don't have that disease, they will test negative using that investigation. An example of this investigation is anti-double-stranded DNA for systemic lupus erythematosus. So most people who do not have SLE are going to test negative to anti-double-stranded DNA. Why a test with a high false negative rate is a test that will show you negative, but a lot of the people that it tests negative still have the disease. An example of an investigation that will give us a high false negative rate is if you're using an X-ray to diagnose a brain stroke, for example, instead of a brain CT. So you have a lot of people with normal looking head X-rays when there is actually a pathology going on. So it will tell you the test is negative, but that is false information. Is that clear, Dr. A?
Yes, it is. Thank you.
So more details will be given when we commence our full classes, and more formula to be able to remember these pieces of information will be shared as well. Okay. Dr. A, since your internet is good at the moment, help us read the third question.
A random study on pulmonary embolism shows 10 patients out of 100 died who did not get treatment, and 10 patients out of 100 died who got proper treatment. What is the single most likely absolute risk?
So if we look at the question is telling us that people who got treatment, there were 100 in total, right? Doctors, or Dr. A at least.
Yes.
Okay. And then people who did not get treatment, they were 100 also in total. Is that correct?
Yes, it is.
Okay. So In each group of people, both that is
Yeah.
yes, it's as simple as that. So to put it into simple perspective for maybe when the calculation is not this easy, what you want to do is the 10 divided by 100 times 100. Looks like we're moving in circles, but like we said, the numbers may not be this straightforward. So 10 divided by 100 times 100 is going to give you 10%. And for that reason, the absolute risk of events occurring in the population you are studying is option D, 10%. I hope this is clear, doctors.
Yes. Yes.
Okay. So I think Dr. Paula wanted to read a question earlier. Dr. Paula, are you still there?
Yes.
Okay. So Dr. Essien, please
Okay.
get ready.
A town
to read.
has a
Continue, Dr. Paula.
okay. So a town has a population of 500,000 people. In a 5-year period, 1,250 cases of lung cancer were registered by death certification. It was also found in the same town, 500 people were diagnosed with lung cancer from the community hospital. The 1-year survival rate is 0%. What is the single most likely annual prevalence of lung cancer per million in this population? Should I read out the options?
Yes, please.
Okay, so A, 200, B, 400, C, 500, D, 700, and E, 1,250.
Okay. So this question is a bit complicated. It just requires a little amount of critical thinking. I think the takeaway or the take home from these sets of questions is that you have to work on some degree of arithmetic skill when you're preparing for the Plab exam, because you won't be allowed to use any aids or calculators or phones or anything like that. Now, Dr. Paula, we said we're looking at a 5-year period, right?
Sorry, we're looking at what?
A 5-year period.
Yes.
Good. Now, in this 5-year period, how many people died of lung cancer?
1,250 people.
Very good. So let's write that down somewhere. We have 1,250 people. Then, how many people, did not die of lung cancer?
So just diagnosed cases were 500.
So in this 5-year period, so we have two sets of people, those that were diagnosed and those that didn't. Those they were diagnosed, they didn't die, and those that were diagnosed and died. So now we have 500. So we can confidently say at least 1,250 plus 500 was the total number of people, or were the total number of people that had lung cancer within the 5-year period. Is that not so?
Yes.
Okay, when we sum up these two values, what do we get as the final answer?
1,750.
1,750. Excellent. Okay. The 1-year survival rate is 0%. So it means nobody survived lung cancer beyond 1 year. So we don't expect these data to be interposing upon each other. That is most likely the new people those people who died had not been alive for so long and so on. What is the single most likely? The issues now arise with this word, annual prevalence. So we want the annual prevalence of lung cancer. Then the second issue is per million in this population. So now we have a 5-year number, that is 1,750. How do we find the annual prevalence on this number? Dr. Paula.
We divide it by 5.
You have to divide it by 5.
Yes, so you divide it by 5. 17 divided by 5 is going to be 3. Remaining 2, because 5 times 3 is 15. So that 250 divided by 5 is going to be 50. I hope we're not leaving anybody behind. Doctors, I hope everybody is following so far.
Yes.
So what is this 350? What number does this represent?
The annual death.
Yes, the annual prevalence, not just the death, because remember we added deaths plus newly diagnosed people. So this is the annual prevalence. The next question is per million people. This town, does it have up to 1 million people? No. It has 500,000 people. So this 350 is per 500,000 people. How do we know this number? What do we expect the number to be if there were 1 million people, not 500,000?
Be multiplied by 2.
Yes, multiply 500,000 is 350. If there were 1 million, it would be 350 times 2, and that will be equal to
700.
700. Is that clear, doctors? Doctors, is that clear?
Yes, doctor.
Okay. So let's proceed to the next question. Dr. Essien, I hope you will be able to read the question. Another question on epidemiology and research. Dr. Essien,
I can hear you. The screen is frozen.
please read the question.
Can you hear me?
I can hear you, Dr. Essien. So please read the question.
The screen is frozen. So, yeah. Now it's moved. Okay. A study was conducted to look for associations between hard water and childhood eczema. Patients were selected and allocated into 2 groups by method of computerized generated randomization. Group A had water softener installed in their homes before birth of their child. Group B was the control group and did not have any changes to their water system. Both groups followed for 6 months with monthly follow-ups, skin testing for the newborns. The researchers did not know which group the patients were allocated throughout the study. What is the single most likely study design? A, case-controlled study. B, cohort study. C, single-blinded randomized controlled trial. B, double-blinded randomized controlled trial. E, cross-sectional study.
So what are your thoughts?
I would say D, double-blinded randomized controlled trial. I'm not sure.
Okay. I really like that answer. It means you understand the point of the question. Remember, we said when you're following people into time, it becomes a cohort study from earlier.
Yeah.
But it doesn't apply if you are changing something in their lives. So for a cohort study, you are just observing them. That is an observational study. If you begin to test something on them, it becomes a trial. Now they are trying the water softener if it is going to make any difference. So this becomes a trial. And what's the word control trial? What makes this whole process a control trial, not just any kind of trial?
Their influence, the influence of the scientists.
Yes. And more importantly, the word control, remember, like we said, is when a certain group has something and you're comparing against another group that doesn't have it. So that group, the other group that doesn't have it, is the control group. So, and you can even see in the question here, it says the control group did not have any changes. So this tells us, oh, this doesn't fit. This tells us what kind of study it is. So we are looking at a control trial, and then the word randomized is because they use the computer to differentiate the groups. They did not choose the people to get the water softener. So it makes it a randomized control trial. Now the question is it a single blinded randomized control trial or a double blinded randomized control trial? And Dr. Essien, you went with double-blinded randomized control trial, which was very good. It means you've eliminated every other option apart from these two.
Yeah.
But I want to suggest that if you think about it, even though the question is silent, the question only says that the researchers did not know which groups the patients were allocated. So it is clear that at least the researchers are blinded, meaning at least this is a single-blinded randomized control trial. Then, do we know if the families were aware? That is the subject. Were they aware of the water softener installation or they were not aware? Since the question is silent about it, it most likely means they were aware, since it says only the researchers did not know. But if you think about it logically, it is unethical for you to go and install something in somebody's house and not tell them that you are installing something. So you can't just go to people's house randomly in the middle of the night and install a water softener and you come and start studying them. No, they have to be aware that they are a part of the research and something is going to be installed in their house. So from that piece of information, in addition to this sentence, we can confidently come to the conclusion that this was a single blinded randomized control trial. Is that clear, doctors?
Yeah.
Any questions?
Yes, please. I didn't quite get why it was single-blinded randomized and not double-blinded. You said because
Okay.
I didn't really get. Could you re-explain, sir?
Okay, we said it was single-blinded because this question states that the researchers did not know. It did not say anything about the patients. So if the question had said the researchers and the patients did not know which groups they were allocated, then it becomes researchers were blinded, the patients were blinded. But it only states one group was unaware. That means it's only the researchers that were blinded. That is why it is a single blinded randomized control trial. Is that clear?
Yes, doctor. Thank you.
So when we start our full classes, we are going to look into why this makes sense here, why the research still makes sense for it to be single-blinded in this particular study. But if you want to test your own medication, let's say you invent a new drug, Dr. Essien, and you can't use a single-blinded randomized control trial, or even if you do, it is not going to be as credible as a double. We are going to look into all those details and understand why those things apply in the places they do apply. Is that clear?
Yeah, it is.
Okay. Thank you very much, Dr. Essen. Dr. Covenant, please, can you read the next question? it is not going to be as credible as a double. We are going to look into all those details and understand why those things apply in the places they do apply. Is that clear?
Yeah, it is.
Okay. Thank you very much, Dr. Essen. Dr. Covenant, please, can you read the next question?
A 5-year-old child presents with fever and pallor. His parents said he's always tired and okay, next one. He's always tired and not as active as the other children around his age. On examination, splenomegaly was noted. Blood results show hemoglobin 7 grams per deciliter, white blood count 2 times 109 per liter, platelet 42 times 109. What is the single most likely diagnosis? Should I read the options too?
Yes, read the options.
Okay. Acute myeloid leukemia, acute lymphoblastic leukemia, chronic myeloid leukemia, and Hodgkin's lymphoma.
Okay. So before we even analyze the question, Dr. Agweru and Dr. Ijogu, please, if you're not both busy, we would like you to prep yourself in order to read the subsequent questions. Now, looking at this question, it gives us a case scenario of a child that has features of anemia, as we can see with the pallor, easy fatigability, and then we can see fever, which is a systemic symptom, is not specific to anything. And then what can we say about the full blood count, Dr. Covenant?
Pancytopenia
Yes, every bloodline is
is
low.
low.
Okay. So the patient has pancytopenia.
Pancytopenia.
Okay. Now, looking at our differential diagnosis, this, to me, if this was real life, you don't have enough information to confidently stick out your neck and make a diagnosis. But thank God this is not real life. This is an MCQ, that's a multiple choice question exam. It means among these options that were provided, which do you think is most likely? I want to go ahead and eliminate these two. Do you know why I'm trying to eliminate them, Dr. Covenant?
First of all, chronic lymphoblastic is always seen is rarely in children, mostly in adults. Then for
So
chronic myeloid, you will not have pancytopenia.
Yes.
It mostly be leukocytopenia.
Exactly. And both chronic forms of leukemia are more common in adults,
In
not
adults.
just children. Yes. So for this, because it doesn't tell us to state the diagnosis, it just says the most likely diagnosis. So the fact that we just saw a 5-year-old, it is not very likely that if they have leukemia, it will be a chronic form of leukemia. It is most likely an acute form of leukemia. Yes. So we are going to use our information on epidemiology, incidence, and prevalence. So if we are looking at acute myeloid and acute lymphoblastic leukemia, which one do we think is more common, or which one do we think is the most likely diagnosis?
Acute lymphoblastic leukemia.
Yes, acute lymphoblastic leukemia is more common. And for that, because you can't really differentiate the predominant method of differentiation is histopathologically and through laboratory investigations, which we are going to look at in more details when we start our classes, how to distinguish each of them. So the simple fact that with this information, we cannot differentiate, and lymphoblastic is more common, just like Dr. Covenant has said, the most correct answer or the most likely diagnosis will have to be acute lymphoblastic leukemia. Is that clear, doctors?
Yes, sir.
Okay, thank you very much, Dr. Covenant. Before we proceed to the next question that Dr. Ijogu will help us read, we have an important announcement from the administration of Medituts Academy.
Good evening, everyone.
Good evening. Good evening, sir.
Yeah. Sorry that I had to interrupt your class. Don't worry, after now you would continue. Just a few information that have to be passed across. I want to believe that so far the demo classes have been insightful for you all right, and also informative. Interestingly, this would be the last demo class we'll be having before the main classes commence. Okay, so the main classes would be in preparation towards the next Plab exam, which will be holding in May 22nd, that's 22nd of May, right? So that's what the class will be geared towards. Okay, so the main class will be towards the next, let me not say the forthcoming, because the forthcoming one is happening tomorrow, right? So the next Plab class. So for those of us that will be preparing towards that that exam, the main class definitely will be for you. Okay, so it will be a 2-month plus class. I think 2 months, 2 weeks, or thereabout, or 2 months and a week class, and it will be running from the 5th of March through to the 17th of May. Okay, so almost close to the exam date, at least so that you can still be on fire before you go for your exam. All right, so that's going to be the duration. So from the 5th of March, that's when the main classes will be commencing. I believe the tutors have been highlighting and like talking a bit about it, right? So the 5th of March, the classes will commence, and like I said, it's going to run through to the 17th of May. Okay. Then also, yeah, so for the timing, it's an evening class because as we know, a good number of you, if not all, you're all working class. So your daytime is usually occupied. So reason why we're having it in the evening hours. All right, so the time is going to be from 6 p.m. All through to 9 p.m. So it's going to be a 3 hours class, right? The days, Tuesdays and Thursdays, okay? Then if need be, would include Saturdays, but primarily Tuesdays and Thursdays, all right? Because we don't want to choke you with so much that you don't have extra time, for yourself to study or to do your own personal study, okay? So those are the class days. So just to recap, the main classes commence as from the 5th of March, running through to the 17th of May. The class days are Tuesdays and Thursdays primarily. Then, pending how things unfold, we might be including Saturdays, but primarily just Tuesdays and Thursdays. Then the class time, 6 p.m. to 9 p.m. Okay. Now, in addition to this information, so other things that will be done in the course of the class, just like you are currently experiencing, we'll be having question review sessions, just like this one that you're having currently. We'll also be having discussion classes centered on the high yield topics, okay, and also answering questions from the high yield, centered on the high yield topics, all right? Also, there'll be mock exams and review of the questions, okay? Then also a personal study plan will be drawn up, right, for everyone, okay, depending on your schedule and all of that. So a study plan will be drawn up for you. Then, yeah, so in a nutshell, that's what the classes would entail, okay? Then what else? Right, so it's going to be an intensive class. I believe from the demo classes, you should have at least have an idea, okay, of what is in store. So it's going to be an intensive and also an exam-focused class, all right? So if you're going to be writing the next Plab exam, we encourage, okay, that you join in on the class. The fee is just 150,000. Okay. I think more information regarding how to register and all of that will be put up on the WhatsApp chat. So, and also a contact number will be put up there in case you need to get clarification or you have inquiries to make and all of that. Okay. So in a nutshell, these are the information surrounding the main classes that you have been hearing about. Okay. So I don't know if anyone has any question based on what I've just said before I hand over to your tutor to continue. Okay. All right. So I'll take our silence to mean there are no questions. So I'll hand over to your tutor and see you in your next class. All right.
Thank you very much, the head of our main department. So without further ado, let's proceed to the next question. I had earlier called on Dr. Ejioku. Are you available? Or Dr. Gifts Imaikai? Either of you? 3, 2, 1. Okay.
Hello.
Can anybody? Okay, Dr. Gifts. Read the question.
Okay, so a 33-year-old man complains of tiredness for the last 3 months. On routine blood test, she is found to have a hemoglobin of 85 gram per liter, low mean cell volume, and low ferritin. What is the single most likely diagnosis? A, iron deficiency, B, folate deficiency, C, thalassemia, D, anemia of chronic disease, E, sideroblastic anemia.
Okay. So from the questions, what are the key things you've noted from the question?
We can say that she has she has an anemia, and she has low ferritin and low mean cell volume.
So the low mean cell volume tells us that it is what kind of anemia?
A microcytic anemia.
Yes, it tells us that this is a microcytic type of anemia. So anything that is not microcytic here is probably not correct. So things like anemia of chronic disease that is predominantly normocytic, things like folate deficiency that is macrocytic, they go out of the window. Okay. What about the low ferritin? Or what is ferritin?
Ferritin is how iron is stored in the body.
Yes.
The form.
So it's the storage form of iron. So if the ferritin is low, it means this patient has some form of iron deficiency. It's as straightforward as that. Is that clear, doctors?
Yes.
So, as we always say, we are going to delve much deeper into all of these pieces of information once we start the classes in full. Do we have any questions before we proceed? Doctors?
No questions, sir.
Okay. Thank you very much. So let's proceed to the next question. Does anybody want to volunteer and read the 8th question? So now we have to go back to everybody who has read before, since it seems everybody has already read the question. So in alphabetical order, Dr. Chioma or Dr. A or Dr. Covenant, any of you?
I'll read.
Okay.
A 21-year-old man presents with mild jaundice. Hemoglobin is 75 grams per liter. Reticulocytes are 7%. There are spherocytes seen on the blood film. He has no past medical history of any significance. What is the single most appropriate investigation? Do I have to read the options?
Yes, please.
Okay, so option A is sorry. Sorry.
You want somebody else to continue reading?
Yes, please.
Okay. So let me just read the options. The first option is glucose 6-phosphatase phosphate dehydrogenase enzyme assay. The second option is direct Coombs test. The third option is indirect Coombs test. The fourth is bone marrow biopsy. And then the fifth is sickle solubility test. Now, the question says this patient has anemia, has reticulocytosis, which means this, what do reticulocytes tell us when we have anemia in the blood film? It most likely means this is a hemolytic process. So whenever you see reticulocytes, you should think of hemolytic anemias, like sickle cell disease, thalassemia, autoimmune hemolytic anemia, hereditary spherocytosis, and so on. Now, since we are thinking of a hemolytic cause, the next thing we want to see, and we have spherocytes in the blood film, so it significantly narrows it down to either hereditary spherocytosis or autoimmune hemolytic anemia. Because those are the two main types of anemia that cause spherocytosis. Is that clear, doctors?
Yes,
Doctors,
doctor.
is that clear? So, between hereditary spherocytosis and autoimmune hemolytic anemia, which investigation do we have on our screen? It is going to be autoimmune hemolytic anemia that can be diagnosed with a direct Coombs test. Is that clear, doctors? Doctors, is that clear?
Yes.
Okay. So a direct Coombs test is going to tell us that this patient either has autoimmune hemolytic anemia or does not.
Doctor, I have a question.
Yes.
I thought for G6PD enzyme deficiency, that's where we find spirocytes or the antibody. So in this case, why is that not a correct answer?
Hence bodies are not spirocytes. Hence bodies are a specific appearance of red blood cells that can be seen in conditions like G6PD, and they look round, but they don't look spherocytic. There is a slight deformity in a hen's body. So it's not the same as a spherocyte. Is that clear?
Yes, doctor.
And
Thank
that is
you.
why we started by saying spherocytosis. When we see spherocytes, we are either dealing with hereditary spherocytosis or autoimmune hemolytic anemia. So if we wanted to diagnose, if we don't find the direct Coombs test to be positive, then we are quite sure that it is hereditary spherocytosis. But you can do other things like osmotic fragility test, acidified glycerolysis test, and so on, many other investigations. But the main thing is the direct Coombs test. Okay.
Thank you, doctor.
Okay, you're welcome. So let's move to question 9. Dr. Okay, Dr. Itunolua, since we are sure your network is stable, please read question 9. Dr. Itunolua,
Yes,
are you
doctor.
still there?
Sorry. Yeah, my
Uh-huh.
network went off for a moment. A
Ah,
55-year-old
sorry.
man presents with rubbery, painless lump on his neck. He also had significant weight loss over the past 6 months, fever and night sweat. The diagnosis is Hodgkin lymphoma was later confirmed with a lymph node excision biopsy. What type of cell is associated with Hodgkin's lymphoma? A, T cells, B, Ritz-Sternberg cells, C, B cells, D, macrophage cell, E, Auer rod. Answer is B, Ritz-Sternberg.
Easternberg cells. Excellent. I completely agree with you. So this is a very straightforward question. It's talking about the the histopathologic finding in Hodgkin's lymphoma, which is Reed-Sternberg cells. So as we proceed, also we'll also consider dividing the classes into different sections of where we just focus on studying some things. For example, we may take an entire class that will focus on studying histology and histology related material, ECG and ECG related material, and so on. But all of that will be delved into when we move into our full classes. Okay, thank you very much, Dr. Itunu. Let's proceed to the last question. Okay, can we find somebody to help us with the last question before I volunteer to read the question in the next 6 seconds? Somebody, anybody? Last question. Okay, Dr. Suleiman. A 4-year-old boy presents with hematolosis following a minor fall. His grandfather and uncle have similar bleeding problems throughout their lives. What is the single most likely mode of inheritance? So, doctors, hematolosis following a minor fall, what does it tell us?
That there is a bleeding disorder.
Yes, that there is a bleeding disorder, meaning the patient is bleeding into his joint. Now, the second piece of information is that this disorder was present in his grandfather and his uncle. So what does this also most likely tell us?
That it is hereditary.
Yes, that is hereditary. Excellent. Now, when we put all these pieces of information together, the single most likely mode of inheritance, if the grandfather and the uncle have it, is going to be
X-linked.
X-linked. So we know that it is nearly impossible, but not absolutely impossible, nearly impossible for X-linked disorders to manifest in women. Why? Because they have another sex chromosome that is not X. Sorry, they have another X chromosome that is most likely, okay, they have another X chromosome that is most likely not going to carry that disease. But for a man, once he inherits the X chromosome that carries the disease, he doesn't have another X chromosome that his body can use in terms of manifesting the phenotype and the physical characteristics that he will develop throughout his life. So the only thing that he will have on his sex chromosomes, that is the X chromosome, is the disease. So he will definitely have symptoms of the disease. I want to repeat myself. A woman or a female who inherits a sick or an abnormal X chromosome from either the father or the mother will not develop symptoms because she has two X chromosomes. One of them is sick and one of them is healthy. But the man, he only has what's your X chromosome. The only choice he has to show is the bad X chromosome. And that is why he is going to always manifest the symptoms of the disease. The only time a woman will develop physical symptoms of an X-linked disorder is if she's extremely unlucky and both her father and her mother have the same X-linked disease and they pass down that disease in their X chromosomes, which is extremely rare. And if we look, we are saying it's X-linked because the grandfather had it and the uncle had it. So this is just for entertainment purposes. But do we think this grandfather is the paternal grandfather or the maternal grandfather? Doctors, can anybody throw a guess? Is this the paternal grandfather or the maternal grandfather? Okay, we have one person with paternal. Any other person? So for you to remember easily, where is the only place a male will get an X chromosome from? In this whole universe, where is the only place a male can get the X chromosome from? Is it the father or the mother?
From the mother.
From the mother. So any X-linked problem in the life of a male child is absolutely from the mother. Why? Because a boy can never inherit an X chromosome from his father. Do we agree that a boy can never inherit an X chromosome from his father? Doctors, can you all hear me?
Yes, we can.
Yes, I said, do we all agree that a baby boy or a male child can never inherit an X chromosome from the father?
Yes.
Okay, only one person seems to be following this explanation. Okay, yes, at least two people agree. So a male child can only inherit an X chromosome from the mother, because if he inherits an X chromosome from the father, it is no longer a male child, it is already a female child, so it won't be a boy. And since the mother only has X chromosomes to give, that means if a child has an X-linked disorder, he got it from the mother. And that's why the question is silent here. Saying it doesn't state whether it's his paternal grandfather or the maternal grandfather that has the disease. It just states his grandfather and uncle, meaning everybody expects that this child, this grandfather probably gave the X-linked disease to the mother, who in turn did not develop the disease but had the X chromosome and then gave it to the son. Is that clear? Doctors, is that clear? Yes, yes, yes. Okay. So with that, we've come to the end of today's session. However, somebody sent a direct message to admin, which he would like to answer to everybody. So please stay back for the announcement before we call it a day.
All right. Thank you so much, Dr. Suleiman. Okay, so someone sent a question rather, and I feel it's best to just generally answer it before everybody. So the question was, would the classes be recorded? Okay. Now, we understand the nature of your schedule, and we also understand that there might be days where, due to your other commitments, you will not be able to join class. Okay. So we understand all of this. And because of that, yes, the classes will be recorded, okay, for later consumption by you. All right. So we already have structures in place, to cater to making this possible. All right. So in the event that you're unable to attend the class due to, like I said, maybe work commitments or other engagements you may have, you can rest assured to still catch up on what was done in that particular class that you missed. All right. So yes, the classes would be recorded. Okay. So just to close, I know, of course, you all are familiar with the Plab exam. You must have come in contact with numerous Plab resources, preparation resources, and all of that. Okay. But if you need someone to guide you on how to prepare for this exam, how to study for the exam, what to look out for while answering questions. All right, literally someone to spoon feed you, to lead you by the hand. Okay, then this class that I'm talking about is for you. All right, like I said earlier, it's going to be very intensive and also extremely exam focused. Unnecessary information and all of that, of course, will not be part. Okay, so it's going to be extremely exam focused. All right, so again, you're going to write in the next exam, next lab exam. This class is for you. Even if you're not going to write in the next lab exam, maybe the one in August or in November, all right, but you want to start early preparation, why not? You can also join in. They say there's not like too early to prepare for an exam like this, right? So you can also join in and participate in the sessions. Okay, so just to recap, 5th of March, that's when the classes begin. I think that's from tomorrow, if I'm not mistaken, registration will be opened, okay, for anyone that wants to join to begin their registration. All right. Yeah, so the 5th of March to the 17th of May, that's going to be the duration of the class. Okay. All right. So I think with that, we've come to the end of the free demo classes. I honestly hope they've been helpful to you and they've been beneficial to you as well. Okay. Whatever it is you have seen demonstrated in the demo class is a tip of what is in store for you when the main classes begin. Okay, so we hope to see you all come 5th of May, and it's going to be an interesting ride. Okay, so thank you very much, and do enjoy the rest of your evening. Have a good night.
Thank you very much.